It's like the thyroid. It's kind of like the engine of the car, right? It's your metabolism. So if your car's slowing down, we're not like, oh, I need a new engine. Maybe you need an oil change, right? Or maybe the spark plugs need tuned up. So again, like the adrenal glands, if you tune up the adrenals, get those working back again, then your thyroid just takes off, like you're putting new spark plugs in there, right? So we got to stop treating the symptom or the organ and look at the body as a whole.
Hey everybody, Dr. Axe here along with Dr. Axe. I have my brother on today, Dr. Jordan Axe. He is a doctor of functional medicine and chiropractic physician in Tampa, Florida. And he treats people around the world come to see him for his functional medicine practices. And so really excited to have him here today. He is my younger brother. And I'll just say, I'm just so proud of him. The guy's an amazing physician, has built a really successful clinic there in Florida. And again, as I mentioned, sees people from all over the world. He specializes in autoimmune disease, thyroid conditions, and other issues like chronic pain. And so really excited to have my brother on today, Dr. Jordan Axe. Hey, Jordan.
Awesome. Thank you so much for having me. And yeah, it's good stuff.
Yeah, well, hey, I'm always excited to connect, man. I know that you and I, it's so fun because I know when we were younger, like we had a big age gap. I was about 8.5 years older than you, but like now that we both practice natural medicine, it's been so fun being able to just talk about these things over the years. And I know
we were younger. Yeah, didn't have as much in common, but as we get older, we just have more and more in common. So
it's always good. And then there's a few things you're definitely better at than me, golf being one of them. So I know you played in high school and are almost a scratch golfer. So that's always impressive. But one of the things too, I'll just say, like the reason I was excited to have you on today is that one, and not just because you're my brother, but also because you're such a great practitioner. I think, you're the person that like I feel comfortable referring people to. Like if I have if I have somebody, because I'm no longer in practice, if I have somebody who has autoimmune disease or hypothyroidism or Hashimoto's disease or chronic pain, I'm really excited to be able to refer them to you because, the feedback I get from people that have seen you is always, wow, I can't believe the care I got, and just people are always impressed with the results. And one of the reasons for that, Jordan, I'm excited for you to share this story. You fought off autoimmune disease and thyroid issues yourself. So start off talking about your story about how you naturally beat autoimmune disease and what specific diagnosis did you have and how did you do it?
Yeah. And you learn this stuff so much quicker when you treat yourself and you go through it. You can look at something 10 times, but if you do it once yourself. So any patient that I ever recommend diet, supplement, I've done all of it myself. Okay. So I don't do anything, but I'm going to always treat myself first. And so I've seen all the different, what works, what doesn't work. But yeah, really at a young age, I think, going to regular doctors and getting told, hey, your diet has nothing to do with your acne or your skin or, chronic sinus infections. That was what, I couldn't sleep at night because I was so congested and just tired. Wasn't sleeping well, waking up in the middle of the night. And you're not getting answers from the doctors, steroid creams, antibiotics. That's in medicine, like when in doubt, give antibiotics and steroids. That's what we...
And Jordan, I do want to mention growing up, I remember this, like when you were a kid, you were always having immune issues, right?
Always
having skin issues, always immune issues. And so that was definitely a problem even from when you were a kid.
Yeah, absolutely. So yeah, it was frustrating. I was just sick of it. And what's interesting is I tried to start eating better and you were learning about health at the time.
Yeah.
And I was starting to put some of it together, getting a little bit better. And I remember I started to eat a bunch of fruit and I was like making my own lunches and looking back at it now, it was like, well, I still had a lot of sugar in my diet because I was eating all this fruit. And then it was you that said, hey, see this functional medicine doctor in Atlanta. And they're the ones that, they put me on a low carb, like a ketogenic diet. They did gut testing on me. They did food sensitivity testing instead of allergy testing on me. Thyroid testing, and they're the ones that diagnosed me with an autoimmune condition and said, hey, here's why you're having eczema, here's why you're getting sinus infections, and oh, by the way, you have an autoimmune disease. Thanks for letting me know that. And it was really, we went through this functional medicine process, and within 9 months autoimmune disease, totally reversed, numbers negative, and stopped getting sinus infections. And ever since that day, I haven't stopped going through protocols myself and, trying to treat other patients.
Yeah, and I remember talking to you, and the number of results you saw were so incredible because you told me after. And by the way, just to give a little bit more background on the story, so I gave Jordan some advice here on what to do. He followed some of the dietary things, went gluten free, and you saw some improvements.
I did.
But then, at the time I wasn't doing as much of the lab work anymore, and so I had you go see Dr. Gez in Atlanta.
Yeah.
And then, he did all the lab work and we were able to really dial in and see, hey, here are all the things going on. You were a great patient. You followed all of those protocols.
Yeah.
And you noticed, I remember the time you saying your immune system was the strongest it's ever been. Your energy was better because I know you were having those thyroid issues. You started sleeping better. Your skin looked the best it ever did. I mean, it was literally like, feeling like a different person over the course of 9 months, right?
Yeah. You kind of got me, the first level or two, especially, food is medicine, right? So we did a lot of that. But yeah, the testing was a game changer. And I think for a lot of patients, sometimes I know how to treat patients, but some people want that objective data. Like, hey, I don't want to guess what I'm taking. I want to know here's exactly what I'm low in and exactly what my body specifically needs. And that's what I'm passionate about. Being in engineering, I like that more objective kind of data when analyzing a person, their lifestyle, their diet, everything, and just trying to put it in a very efficient, systemic order.
Yeah, and that's one of the things I love about the way your brain works. So share just a few stories growing up. I was always more into writing and, English. And so I loved writing and communication. Jordan, my brother here, he would take a car, and I'm not over exaggerating, take apart a car engine, put it back together. He went and studied under engineers, looked at almost getting his engineering degree and then decided to go into more natural medicine later on. But again, your brain really works like an engineer. And I understand, again, some of these tests today are so powerful in being able to empower people and also really give us greater insight into what exactly is going on. Share with us today, because I know you run your functional medicine clinic there in Tampa. You also have your virtual clinic, right? Where I know people, Zoom in to see you or Skype in to see you from all over the world today.
Yeah.
And that being said, what are some of those tests that you run and work with patients on today?
Yeah, absolutely. And, we're actually coming out with our Axe Holistic Medicine method, right? And trying to put this into order so people don't get so confused and doing 1,000 different detoxes and protocols. We're going to, in functional medicine, we say anything can cause anything. And we've been accustomed, even in the holistic medical world to some degree, is we treat symptoms naturally. It's better than treating a symptom with medication, but it's only 1 degree off of that in some fashion. So there's an order that you need to treat the body in, and the testing allows us to figure that order. So one of the things that we're putting together is you got to treat the neuroendocrine system first, your adrenal glands, your hormones, that's your endocrine. That's how your organs communicate, right? And in chiropractic, that's so important because the brain communicates with the body, right? So you got to fix neuroendocrine. Number 2, you got to fix the gut, right? And I've learned so much about the gut from you. Really, that's your expertise. And then number 3 is detox, okay? So what's interesting about this is your main problem could be because you're toxic. The problem is if you have leaky gut, you can't detox because you're absorbing through the leaky gut, okay? If you have adrenal fatigue, your immune system is controlled by your adrenal glands and so forth. So if you don't get your neuroendocrine system up, then your gut can't heal and your body can't detox, right?
Yeah.
So this is honestly a recent finding. So everyone listening, this is life-changing for me, even as a functional medicine doctor, learning these principles because I was treating people's guts and sometimes I was running into a roadblock. Not everyone, but there was some people I'm like, why can't I get their guts better? And then I realized if their thyroid was low, their adrenals were low, their body didn't have the stress response and the power to actually heal those organ systems.
Well, and Jordan, what you're sharing too, it's so much of, a lot of what we both teach now, but for myself too, it's a lot of Chinese medicine. There's 5 organ systems. Any one of them can be the root cause, and the 3 you're hitting on are the most common that are at the root
liver,
cause. Yeah, absolutely. And I do want to say this too. By the way, anybody listening, my brother runs, and I love the name of your clinic, by the way. It's called Axe Holistic Medicine. But one of the things I love about the way you practice is it's really looking at the root cause, right?
Yeah,
It's
exactly.
addressing the root cause. And so again, you can check out Axe Holistic Medicine or search Dr. Jordan Axe if you're interested in consultation or talking to him more and that sort of thing. So continue on, Jordan. You were talking about, hey, it could be any of these three areas. It's the root cause of your autoimmune disease or whatever problem you're struggling with.
Yeah. So again, we had that's the order we have to treat in. Regardless of what's causing your problem, you have to start in that order, no matter what. And so the testing, probably one of my new favorite tests is called an organic acids test, which I know you're familiar with. And there's 70 biomarkers, and it's actually a urine test, and it shows you yeast overgrowth, bacteria overgrowth, which is gut, right? Number 2, and then it shows you liver, phase 1, phase 2 liver detox pathways. And then it shows you your neurotransmitters, serotonin, dopamine, epinephrine, which have to do with your adrenal glands, methylation issues, genetic issues, B vitamins, glutathione. So it allows us, and energy production of your cells. So basically it identifies all these different systems, and it tells us specifically through supplementation how to fix all these different issues. So if this test said, hey, this neuroendocrine issue your cells need to make more energy. We'll fix that first. Then we got to clear candida, and then we got to detox. So it would tell us how exactly we're going to accomplish the neuroendocrine gut and detox. It tells us how to do that.
Wow, it's really powerful. And I want to also communicate this to everybody. So an organic acids test, as Dr. Jordan's talking about, it's very much also looking at your vitamin and mineral deficiencies is one of the big things. So it literally shows you if you're deficient in zinc. Think about what a big deal that is, just being deficient in that and knowing your exact numbers. It shows you if you're deficient in vitamin C, you can do vitamin D there as well, magnesium, calcium, all of these nutrients. And selenium, that's a big one for your thyroid. So again, looking at all of these things, it actually shows you exactly what you're deficient in. And I want to say this, I mean, this is something all medical doctors should be running. Unfortunately, probably only 1% of them are running these sort of tests versus you. I know you run all of these in your clinic and this is how you find the root cause is, hey, rather than, hey, you've got we're saying your thyroid markers are off, so we're going to prescribe you Synthroid or a thyroid medication to treat your symptoms. What you're doing, Jordan, is you're saying, no, here's what I'm going to do. I'm going to go to the root cause and I'm going to give you all the nutrients the thyroid needs. And not just that, I'm going to go and look at the adrenals.
Yep.
I'm going to go and look at the gut, and I'm going to look to see, is that actually the organ that's actually causing the problem?
Yep. Right. It's like the thyroid. It's kind of like the engine of the car, right? It's your metabolism. So if your car's slowing down, we're not like, oh, I need a new engine. Maybe you need an oil change, right? Or maybe the spark plugs need tuned up. So again, like the adrenal glands, if you tune up the adrenals, get those working back again, then your thyroid just takes off like you're putting new spark plugs in there, right? So we got to stop treating the symptom or the organ and look at the body as a whole.
And what you're mentioning there, those three systems, I want to mention this in Chinese medicine. In ancient medicine, the adrenals were like the battery. And as you referenced it, they're the battery for the whole body. It's like, if that is low, it almost doesn't matter what you do. It kind of affects everything.
Yeah. Yeah. And another test I want to talk about, the adrenals. If you want to get really in depth in hormones and adrenals, there's a Dutch test. And that's actually fairly new technology. That's also a urine test. And that shows your entire cortisol, adrenal, sleep, your entire rhythm up, down, because there's different types of adrenal fatigue, and we need to know what that pattern is. So with the Dutch test, say your adrenals are supposed to go up, and they do, but then like at lunchtime, they just crash. This will tell me that, and then I can give people like licorice drops under their tongue or an adrenal support or cordyceps mushrooms, and they can take that at lunchtime, and then that'll keep their cortisol rising appropriately, and then it will allow it to crash at night so they can go to sleep instead of crashing around lunchtime. So very specific
it's even amazing. Like it even matters what time of the day you take these. And that's why sometimes having someone like yourself, a doctor of functional medicine, walk you through exactly what to do. Because here's the thing, a lot of times if somebody has low energy, you're right, adaptogens like cordyceps or licorice or romania or ashwagandha. A lot of times those are best taken in the morning or afternoon. But if you're not sleeping well, afternoon or later in the day is the best time to take those. So that's a big deal.
Yeah. So again, half the people could just take these things and get better, but all of my patients, they've done some of the basic stuff and they're trying to get more in depth. But technology is amazing. Yeah, we live in a very toxic world in technology and 5G. But the cool thing is we have equal and opposite technologies to allow us to fine tune and treat the body to a whole new level that we never had before. We just have to utilize these things.
Yeah. So Jordan, let's talk about, in any more tests, you talked about those two, the one really pinpointing the organic acids, all the nutrient deficiencies. You talked about the adrenals, any other testing that you use within your practice that you found to be very valuable?
Stool testing. Because you can look at the entire microbiology. Okay, hey, I have leaky gut, I have bloating, and we know that, right? You do a colonoscopy, it's going to be negative unless you're bleeding or dying, right? Stool culture shows you how much of each good bacteria do I have, how much of the bad bacteria do I have, what's the ratio, what's my stomach acid production, bile production, motility rate, right? It shows us all these little details that we need to know to tweak the diet, what kind of supplements to get. There's a very specific herb or supplement for every kind of dysfunction. So it allows us to be, I can put 90-day protocols, and there's 4 stages that the gut goes through. So this test tells us how to tweak every little step along the way.
Wow, that's powerful. Now, what about methylation? This is something I know a lot of people, and I have my own opinions on this too that I can share, but also what are your thoughts on, I know you've worked with people, right? You do methylation testing sometimes?
Yep, absolutely. But what the new thing is, they're finding that if you treat methylation issues, then they don't have methylation issues, can actually make people worse.
Yeah, exactly. Because all these high dose B vitamins, if you're going too high, that kind of overwhelms the nervous system and the liver.
Yeah. Oh yeah, absolutely. Taking something you don't need is not good. Your liver and your body has to process that. Even if it's right, if you drink too much water, that's bad because then it flushes out minerals, right? That's almost no one's problem in America, but I'm just saying.
Yeah, I'm with you.
So a lot of, I have these people that are taking like 50 supplements. I'm like, your body has to process all of that. So that's not always good either.
And that's why I know for you and me, like if I, when I was in your house and, whether it's your house in Florida or my house here in Nashville, it's like, if you open up our supplement cabinets, I know for myself, it's almost all food. I mean, it's like, I have bone broth powder and collagen powder. I've got reishi mushroom. I've got, turmeric. I've got ashwagandha. And even my multivitamin has mostly food, has lots of foods in it. We got probiotics, which actually comes from a food. So it's like, even I prescribe a lot of foods, not to say there's not a place for high dose nutrients, but it's really, if you look at what
in the right setting.
Exactly. Yeah.
Yeah. But, methylation is, especially people with autoimmune disease, ADHD, chronic fatigue. Most people with those conditions just have 80% of them have methylation issues. And it's very important to take a methylated B vitamin or a methylation donor. And I do have that positive, with Hashimoto's. So I have in my fridge every morning 2 pumps of methylated B right under my tongue. It's liposomal, absorbs right into the bloodstream, and that can kick methylation issues. That's one of my favorite supplements. I don't know how many patients they came with some blood work. I'm like, hey, you got some methylation issues. We did the B vitamins. And like a week later, they're like, oh my gosh, depression gone. Like I'm a new person. I'm like, we haven't even started yet. Like, haven't even got all your test results back yet.
It is amazing. I know when we started doing the research, myself and Jordan Rubin, on all the importance of methylation years ago, we started putting all, methylated B vitamins in all of our products because we started seeing like the results and how important it can be for those people that are deficient. Let me ask you this, Jordan, because you mentioned this. You were diagnosed with Hashimoto's disease. So essentially autoimmune disease and a thyroid issue there, and you overcome that, like you have no test markers. So you reverse that naturally. How often in treating patients today do you see patients who have come in to see you? They have a condition like autoimmune disease, like inflammatory bowel disease, like diabetes or something like that. And you've actually seen over the course of seeing you that they no longer have that.
Trying to think of someone that didn't overcome that right now.
So it's frequent. It's something you see most people.
99%.
Yeah, it's high.
I had like one person that was like, you know, didn't make it like that. And that, yeah, it doesn't really happen. As long, again, I always tell people it's not whether you're going to get better, it's whether you're going to actually put the time and the energy. Changing your diet's not easy. Stressing out less is not easy, right? It's a mental conscious decision. So if you're not going to do that, you're not going to get better. But people that are willing to make a life change are always going to get better. So, but I will say, you know, that the psychological stuff, PTSD, emotional traumas, you know, those can be the roadblocks, right? And that causes adrenal fatigue. So if we don't get to those issues, then those are some of the patients that are more difficult, that emotional component. And again, with Chinese medicine, like, I know when I'm stressed, my gut doesn't work, your adrenals crash. So
yeah, and these are all, you know, like in my book, Ancient Remedies, I cover all this stuff. A lot of the stuff that you're talking about is like how to heal that emotional root, because as you and I see in practice, yeah, and today physicians, if you're practicing like an ancient practitioner, getting the root cause like yourself practices, you definitely have to bring that up and go through that with people, because again, people don't realize this. To me, with a lot of times, it's like 50% diet and 50% emotional stress. Like, and honestly, emotional stress might be more, but either way, like you have to address both of those things typically to get 100% better.
exactly. It's like sometimes you get jaded. I'm like, we're just used to seeing people that like 10, 20 conditions are gone. I'm like, oh yeah, you know, they reversed 5 diseases. And I'm like, wait a second. If they go to their medical doctor and tell them that, they'll say they're a lunatic or their labs are off. Like they won't even believe it. They're like, that's not even physically possible. But our bodies are amazing. They can heal if you do the right thing. So it really is cool to see. And I try not to take it for granted, if you will, because it's an amazing thing. But I did have a patient, you know, gut issues went away, anxiety went away, but she couldn't lose weight. She actually even gained a little bit of weight and I was like, I can't figure this out. Ended up doing the organic acids test, and she had mitochondrial dysfunction where her cells just, you know, weren't taking glucose and converting it into energy properly. So we gave her this product called mitochondrial energy, and it's a complex for that. And I was like, hey, do this and then do some intermittent fasting. She hadn't tried that. She was eating clean, but she did those two things, and she just emailed me like a couple of weeks ago. I was like, hey, I just lost 10 pounds finally. But that was someone I was like, I just can't figure this person out. But again, it could be one thing. Like, who would have thought just a little bit of fasting and one supplement would make the difference? But with some of these cases, if you stick with it and you don't give up, eventually we're going to figure out that one little thing that's missing.
It's incredible. You know, I think, and so often it's like peeling back layers of an onion, figuring out, hey, what exactly is the thing that we need to fix here. And sometimes it's most of the time it's multiple things, and multiple deficiencies and multiple toxicities that all need to be addressed. Let's go through a few practical things, Jordan, that people can do right now. Walk me through, you know, generally speaking, what are some of the best foods, or what does a diet look like for most people that they can see some improvement with? Now, I know one of the things you do in your practice, Axe Holistic Medicine, is you customize diets for people, right? You customize nutritional supplements. But what are some of those top foods that almost everybody can benefit from?
I would say the big thing is people are trying to eat more nutritiously, but if the root cause, what a driving force is gut issues, you need to eat a gut healthy diet. That's not necessarily a high, right? If you go raw vegan, you're going to get the most nutrients. That is horrible for your gut, believe it or not. Right. So I would say things that are going to heal your gut, like broth and like Instapot or Crock-Pot meat and veggie soup. I just made it the other night, a whole chicken with vegetables, right? I know you told me it's Chinese medicine, they call it one pot, right? I don't want to steal your line here, but
no, it's all good. I honestly, I didn't come with one pot. There was like a physician 4,000 years ago who made that up. So
well, true, but anyways, it's just, and you almost can't explain it, but just eating that daily is so, just the collagen in it, and just it's easy to digest. You get all those veggies in that meat. It has everything in the perfect ratio to heal your gut. So honestly, that's my number one favorite kind of meal. And then I would say, especially, but what's interesting, like if you have adrenal fatigue, you need to be eating every 3 hours, right? Whereas someone that maybe has diabetes, but they don't have adrenal fatigue, I'm saying, hey, no, you need to do the opposite. You need intermittent fast. You need to fast. You need to do keto. And again, that speeds people's metabolism up, helps with their insulin regulation. So, but again, if you're adrenal fatigue, which a lot of people are, you got to start 3 meals a day, doing the broth, doing the soups, and that's going to work a lot better for you than raw vegan. Let me fast all the time. Again, that's great for some people. Adrenal fatigue, not so much.
And then again, this goes back to ancient medicine. It's like there's not one diet for everybody. Everybody has a unique diet tailored for them. And there's typically a few different diets that work really well for certain people. But we know, you and I both know, hey, somebody who needs to lose a lot of weight or somebody with neurological disease or dementia or certain forms of heart disease, they do great on keto. But,
Absolutely.
But somebody with adrenal issues does not do well on that. So as you're saying, I mean, it's so true. Talk to me about some nutrients. What are some of the biggest nutritional deficiencies that you see with people, whether it be autoimmune disease or thyroid issues? What are some of the biggest nutrients? Maybe your top 3 or top 5 that you're like, these are the top ones in ranking order.
Yeah. B vitamins, we hit that, and especially like methylation issues. Number 2, not a vitamin, but a supplement, is something called betaine HCl. That's actually stomach acid.
Yeah.
That's how you digest food, specifically proteins. Okay. And the more stress you have, the more the worse your diet is, the more older you are, those things all decrease stomach acid. And then you're more likely to acquire a parasite or a bad bacteria, because the stomach acid is what breaks down food and then kills any kind of infections. SIBO, classic example. Because small intestine bacterial overgrowth, you have an overgrowth of bacteria. But if you make enough stomach acid, you have zero bacteria moving into your small intestine, and then it picks up bacteria as it moves into the colon. So that's number 1 to treating SIBO. If you don't get stomach acid up, every SIBO treatment you're doing is not going to work as well as it should.
Yeah.
So, and then that increases gut motility, right? Toxicity. If you don't get the junk out, you're going to build up toxins. So betaine HCl is one of my favorite protocols. So that's why I start a lot of patients off right from the beginning. So so B vitamins, HCl, magnesium, right? Our soils are 90% depleted. I always think about our Aunt Jeannie. Her eye was twitching for like a year or two. They were doing like injections and Botox, and then she takes magnesium one day and like half of her like diabetes goes down, her eye twitches go away. Like furious at her doctor, like, why didn't you test my magnesium levels?
It's crazy. It's like, hey, Aunt Jeannie at Christmas, like, hey, you got an eye twitch, take some magnesium, bam, it's gone. It's just like, it's crazy. Oh yeah.
So yeah, those would be my top 3.
Yeah.
I do think like something that, especially if you're stressed out, something to help your body, ashwagandha, just to help manage the stress is really important.
Yeah, I've found, and I'm with you. I mean, those are some really, really strong recommendations. I do think that, a B complex, especially with liver issues or methylation issues, that is so huge. It is surprising. I mean, the Betty and HTL for people, especially like issues like psoriasis, that's a big issue too. SIBO is a huge one, and that helps with that. I think that's great. And then I'm with you, magnesium. So many people, and people don't realize this, magnesium is actually critical as well for liver function, right? It's really important for, actually, I think it's like over 300 functions in the body. It's a big deal for. What are some of your favorite herbals that you recommend? You mentioned ashwagandha. Any other herbals that you recommend your patients take regularly?
I mean, there's so many herbs out there. People don't, there's like,
I
so
know
much bigger.
I know it's all over the board. It's, and I know I recommend, there's over 100, but what are some of the ones you prescribe the most? You mentioned licorice root earlier.
Yeah, licorice is big. Again, adrenal fatigue is one of the first things you have to treat. So yeah, I would say licorice is up there because it keeps your cortisol in your blood twice as long. So if everything's burned out and you can keep it you don't have to make more of it. You can just keep it in the blood longer. I would say that, and phosphatidylserine is another one.
Yeah.
I did a lot of lomatium root. It's what the Indians treated the flu pandemic with, actually. And it's just a tincture, and they extract it with alcohol, and it's an antiviral called lomatium. And that's probably one of my top ones there as well.
Wow, amazing. So go and you talked about this earlier. So I just want to go back. This is such an important point for people to remember. It's not about a nutrient dense diet. Now, if you've got a thyroid issue, that's more of a diet you'll follow as maybe something for, or I'm talking about for just adrenal issues. Is in Chinese medicine, your body's going to like a lot of the berries, whether it be goji and blueberry and seaweeds and things like that. But if you got a gut issue, it's the diet that's easiest for your body and the diet's that's the most regenerative. So it's going to be bone broth and ginger and turmeric. It's going to be cooked vegetables like carrots, celery, and chard, those green leafy vegetables. That's the sort of diet we all want to follow there. Jordan, talk to me. What is the biggest difference between the three? I'm going to lay them out in three forms of medicine. We have conventional medicine, natural. What people are practicing is sort of like nutrition or natural medicine, and then also root cause medicine or ancient medicine like we practice.
Yeah, that's a good one. So actually, one thing before I forget, I want to mention when we're talking about the testing.
Yeah.
On my website, axholisticmedicine.com, we have an integrated. It's on the very top right, and then you can see the testing that we talked about earlier. And I even have a video on how to read the results and a video going over if you say you were to order the test, what you're actually getting with it. So that's another great.
So again,
resource.
guys, Axe Holistic Medicine, Axe Holistic Medicine. And you can find out more about Jordan there. You can read up all on the testing and everything he's talking about there.
Yeah. So number one, conventional medicine is all their testing, everything that they do, everything they ask is designed to diagnose you with a symptom, right? Or a disease. Okay. Once they can figure out whatever that word is, then they're going to match that symptom or disease with a medication or a surgery to treat that symptom. That's really all there is to it. And if it's not severe enough to be a disease, then they're going to monitor until it gets to the disease process where they can treat it with the medication. That's really it. Okay. Now with natural medicine, it's similar in that way where, hey, what's the symptom? What's the disease called? ADHD, gut issues, whatever, right? And then you treat that with a natural form or supplement. Now, those are better in the sense that they're not always, right? If you take an adrenal supplement, it doesn't always just have adrenal support. Sometimes it has vitamins and things like that to help support the body and the system. But again, you're not treating the root cause yet. You're still just trying to manage the symptom with giving your body some extra support. Okay.
And it might be, hey, you got a cold or flu. We're going to prescribe, oil of oregano, or you got an adrenal issue. You're going to get some B vitamins and maybe an herb like, rhodiola or something. Right. Yeah.
But the problem is that going to prevent you from getting that again in the future?
Yeah.
Not so much. It's just going to help you get rid of it quicker. Whereas root cause medicine, you're trying to, right? If someone has a thyroid issue, instead of giving a thyroid support supplement that's got iodine and selenium in it, which helps your thyroid, let's instead pinpoint what I put together, my top, 4 or 5 causes of all disease, specifically autoimmune and thyroid, adrenals, gut issues, toxicity issues, right? Figure out these different organ systems and just treating them one by one in the right order. And that's going to treat the cause of why the thyroid or the pancreas or whatever is not working properly. So you're doing a lot of indirect treatment, right? Someone's like, hey, I want to lose weight. Well, I'm not going to treat the symptom of weight loss, right? I'm going to maybe get your other organ systems working better, your mitochondria making more energy so you metabolize glucose and burn it more quickly. So it's very indirect when you treat the root cause, right? Because most issues are always secondary. They're never the actual real cause.
Yeah, and this is such a huge deal because, again, if most people, even sometimes that go to natural practitioners, they're not getting the root cause actually fully treated. And listen, again, it's better. I mean, at least you're using something natural. You're seeing some improvements. But this is where I know, when I used to practice like this, Jordan, which again, I don't have my clinic anymore for anyone listening, but now you have the type of practice to a degree that I ran where it's like, well, you find the root cause. And I know that when I was in practice, I had people come to me constantly who said, Dr. Axe, I've been to 10 other doctors. I've been to both natural doctors and conventional doctors, and I'm still not well. And it's amazing when they start going through the process of where you're actually looking through the root cause, you're running blood work like you're doing today, and then you pinpoint and say, you know what? you're deficient in magnesium and zinc and this methylated B12, and you've got a gut microbiome issue here with this bacteria off. And then you prescribe the exact right probiotic, you address the nutrients, you reduce stress, you tell them, hey, it's this time of day, and you get them on a meal plan that's specifically for them, whether they have a gut issue, adrenal, thyroid, whatever it is. And bam, that's how people see miracles. I mean, in the course I know of, 30 to 90 days, it's like people are saying, I feel like a different person.
Yeah, right. It's the process, not the product. And there's a right thing about building a car, putting an engine back together. I mean, here's another example: IKEA furniture, right? If you put that one panel on first and you don't follow the direction, right? You do step 4 first. Oh my gosh, you got to take the whole freaking thing back apart. It's very frustrating, and I find that a lot of patients are very frustrated because maybe they again started treating their gut first, and they didn't treat the stomach acid part of it first, and they didn't treat the adrenals first, and so they jumped ahead, and now we have to start over with them. I'm like, you did all the right things, you just did them all at the same time or in the wrong order. And so it's very important to start from the beginning and go through the process. The power is in the process, right? And doing it in the right order. Well, there's a lot of people that I see that have lost all hope. Again, they've been to 10, 20 other doctors. I used to be intimidated at first. I'm like, oh my gosh, they've tried every diet and this or that. And then surprisingly, when we just go through the process, they get better. And the analogy that I like is 3 feet on the garden hose. Okay. If you take one problem off or 1 foot off the garden hose, does water come out of the other end?
No.
Not really. It's like right. Step 1 foot off, other foot off, boom. And then some patients, it's 4 months in, boom, that 4th protocol they do, everything starts to work normal again. And so you got to have faith, right? And you got to stay consistent, and you have to have the test results in a practitioner to make sure that you actually get there. So,
and I can say this too, from, something about just our family in general, like we practice what we preach. If you look at how our mom healed from cancer, it was following these exact protocols, doing this. If you want to talk about how our dad, had, pneumonia and was in the hospital, right before Christmas this year, and we went in, we gave him the supplements, we told him what to do, all the things, he got better. It's like, and I look at the way that, you and I eat, our families eat, again, it's so, and then, our sister, Rachel, she actually married a chiropractor who also now does functional medicine, everything else in Franklin, Tennessee, just now south of Nashville. It's like, I know we do all this. I can see actually in your room, you have that white thing is you got a hyperbaric chamber there. Which, hey, let's talk about that just for a quick minute. We're going to close up here in a second, but what are the benefits there of that hyperbaric chamber you have behind you?
So everyone knows oxygen is important, especially with cancer, right? Cancer likes an anaerobic environment, does not like oxygen. So our cells, right? We're talking about our mitochondria. Almost everyone wants more energy. And to make energy inside your cell in the mitochondria, you need B vitamins, you need different minerals, and you need oxygen, glucose. You take all that stuff together, boom, and you make energy. Okay. So with hyperbaric, you're breathing oxygen, which puts more oxygen in your body. And then the pressure allows the oxygen to penetrate deeper into your tissues. So it's going to speed up energy production and all processes in your body. You're going to detoxify faster, right? Your immune system is going to work better. You're going to kill more cancer cells. And you'll find that out. I mean, like, never get in that thing if you have to pee, because it's going to speed up your, everything. You can't get out of that thing quick enough. Like, everything is just moving faster.
So one of the most important things I want everyone to take away from this interview is, if you have to pee, don't get in a hyperbaric chamber until you've relieved yourself. So
that'll save you a lot of issues. Yeah.
Yeah. Wow. Man, I think there's one other thing I wanted to ask you about here. Well, just looking at our family, one of the things I'm so proud of and excited about too is how far our parents have come. Like, here's the thing too. It's like, when we grew up, our mom thought fried chicken was healthy. She thought something called juicy, like this juice product that contained only 10% juice, but 90% sugar. She thought that was healthy. So growing up, we weren't into nutrition. We didn't know. And because of it, our health suffered. You had chronic immune issues. I had chronic bronchitis and lung issues growing up. Our sister had terrible allergies. Obviously, mom cancer. Dad had, actually chronic virus, Epstein-Barr, and other things. And then we started changing our diet, and bam, it's just amazing. I mean, our health, like we've got a mom that's 67 years old who still water skis and runs and is in great shape. We got a dad who still lift weights, and we're shooting basketball. He's 70 and shooting the basketball and running around here just recently when we were hanging out and swimming and like super healthy. And so and my dad, our dad is like a meat and potatoes, like military guy. Like I tried to get him to go to a sushi restaurant once, and he was, just looked at the menu and said, "I can't pronounce this. I'm not eating it." So anyways, that's our dad. But again, looking at them now, like how healthy they are, it's like our family now, like we love and enjoy eating healthy, talking about health, and it's just exciting to be able to see like how healthy everybody is in the family now, how now, they're talking about, how to get healthy and all of it. So anyway,
you can make it fun, people, the diet, I can't do that. You can do it. And especially if you get the family to do it, it's so important. When you're doing it by yourself and you're on this island, it's no good, but that's why you need good community, good family, people around you to do these things with.
Yeah, couldn't agree more. I want to encourage you guys, go to Jordan's website. Again, my brother here, Dr. Jordan Axe, runs Axe Holistic Medicine. And you can go to that website. Just go to axeholisticmedicine.com. You can learn about all the blood work he does. And I can say this too, I've been to his clinic. It's an incredible clinic. And I've referred patients there and heard back from them. Man, they saw incredible results. And so if you're looking for help with your hormones, your digestion, autoimmune disease, other immune issues, chronic pain. I know you even do PRP and, and some of that sort of regenerative medicine and things in your office. You do chiropractic, you do
decompression therapy,
physical therapy, all the stuff there. So if you've got a health problem and you want a natural practitioner, I couldn't encourage anybody more. My brother here is a great physician. And also he does virtual consultations. So if you have an issue like Hashimoto's thyroiditis or something like that, hey, you can just go online, set up a virtual appointment to meet with him too. So anyway,
and we use LabCorp and Quest. We can get those kind of labs covered through people's insurance, which is great. And those are national labs. Organic acids test we talked about, that's a urine. You do that at home. So all this testing we can do nationally, and it's not any more difficult than if you're right in Tampa. So we have patients that live 10 minutes away that are too lazy now and doing phone consults. So it's really not a problem at all.
Yeah. And I know too, and I just wanted to just throw out this disclaimer here. Again, for me, like I've referred you patients and they've seen great results. And again, you know the way I'm wired, like if someone else was getting better results, I'd refer them patients, but you see great results. And again, I think it's great. Hey, there are a lot of great functional medicine practitioners and doctors all across the country. But again, like I have people email me all the time asking, "Hey, Dr. Axe, who do you recommend?" And again, you're one of those people that I recommend. I got other friends, Dr. Chris Motley's another guy. So there's other people. But again, if you're wondering, because I get this question, like literally my customer service reps at my company are like, "Hey, who do you recommend?" And so anyways, I know, again, if you guys are knowing who I recommend, it's my brother here, Jordan, amazing practitioner. And there are other people you can email, my company, and they're going to probably tell you the same, Jordan and Chris Motley and some other great practitioners too. But I want to say, Jordan, hey, thanks so much for coming on, man. Just excited to see the results you're seeing and the lives you're transforming. And I know I'm going to see you for a holiday here real soon in a few weeks.
All right. Get your golf game ready.
I know I will. Awesome. Hey, thanks everybody for listening. Thanks to my brother, Dr. Jordan Axe. We'll be back next week with another podcast. Thanks, guys.
God bless.
This podcast is for information purposes only. Statements and views expressed in this podcast are not medical advice and have not been evaluated by the Food and Drug Administration. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. In some cases, individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.